Autism Spectrum Disorder, ASD, usually called autism, is something you're born with. Autism means that the way you think about and experience the world is different to most people. This means you can behave differently to most people, and have different strengths and difficulties. For example, some autism characteristics, things you think, feel and do, can make it hard to express yourself in social situations, but you may also be particularly knowledgeable and passionate about topics that interest you. Autism is highly variable. The word spectrum refers to how autism is experienced differently by different people. Autism is considered a spectrum because it's different for every autistic person. Some autistic people might need more support than others to live the lives they want to lead. The way autism affects you can change as you grow and develop, and experience different environments. Many people who have been diagnosed with autism prefer using the term autistic to describe themselves. This is known as identity-first language. For example, I'm autistic. They consider autism to be part of their identity, not a condition to be treated. For a long time people used the term person on the autism spectrum, known as person-first language. For example, I'm on the autism spectrum, and some people still prefer this. In this guide, we'll mostly use the term autistic. If in doubt, you can always ask an autistic person what term they'd prefer. In the past, autism was broken down into several different diagnoses, including 1. Asperger's syndrome, 2. Autistic disorder, 3. Kanner's syndrome, 4. Childhood autism, 5. Atypical autism, 6. Pervasive development disorder not otherwise specified, PDD-NOS. Because these diagnoses all had the characteristics of autism, they were removed and replaced with Autism Spectrum Disorder, ASD, or autism for short. People also use the term Autism Spectrum Condition, ASC. How common is autism? At least 1 in 100 people in Scotland are autistic. Currently, between 1 in 3 and 1 in 4 people diagnosed with autism are assigned female at birth, AFAB. Read more about autism and gender. Autism is always present from birth, but it might not be recognized or diagnosed until adulthood. Early intervention, in the form of support for their individual needs, can be helpful for autistic children. Even if you aren't diagnosed until adulthood, getting a diagnosis can be very helpful for identifying your strengths and the things you struggle with, and finding support. Characteristics of autism. Every autistic person is different and has different experiences. However, there are some characteristics that are common in autistic people. The way these characteristics show themselves can change with age, and also with the situation you're in. For example, 1. The way you use language and talk might be different to most people. 2. You may use facial expressions, tone of voice, and gestures, hand and body movements, differently to most people. 3. Making and maintaining friendships might be difficult for you. 4. You may be good at seeing patterns or solutions, and be good at seeing solutions to problems that other people might not. 5. You might have set ways of doing things, and find it difficult to do them differently. 6. Autistic people are often very good at understanding and working with structured systems, for example languages, music, and computers. 7. You may have good attention to detail, and be good at spotting mistakes. 8. You might be passionately interested in certain things, and as a result learn a large amount about them in a short time. These interests can change throughout your life. 9. You might avoid or seek out certain sensations, like loud noises or specific textures, more than most people, and experience them more strongly. Facts and myths about autism. There are many incorrect beliefs about autism, particularly the causes of autism or the best ways to overcome the challenges often faced by autistic people. Causes. These things do not cause autism. 1. Bad parenting. 2. Vaccines, or any ingredients in vaccines. 3. Trauma or distress at a young age. 4. Diet. 5. Infections. Causes of autism. The exact cause of autism is unknown, but researchers think it's at least partly genetic, that autism can run in the family. However, autism can also develop when there's no family history. There's no way to predict whether a child will be autistic, even if one or both of their parents are autistic. More research is being done to find out which genes cause autism. It's thought to be caused by more than one. At the end, it is requested you to please subscribe our channel.